Of his coronavirus task force briefings today without the coronavirus task force. The president has already made one misleading statement calling the COVID-19 virus the, quote, China virus. It is not a China virus. It is a virus. Viruses do not have nationalities.
Development. But I want to thank our brave doctors and nurses and frontline responders. The job they do is incredible, and they are truly brave. My administration will stop at nothing to save lives and shield the vulnerable, which is so important. We've learned so much about this disease, and we know who the vulnerable are, and we are going to indeed shield them.
In a virus, it is a virus.
And again, the vaccines are coming, and they're coming a lot sooner than anyone thought possible, by years. If you look at the old system and look at the new system, I think by years. The China virus is a vicious and dangerous illness, but we've learned a great deal about it.
Again, it is not a China virus. It is a virus with no nationality. Viruses are microorganisms. They have no citizenship anywhere.
Our country are doing very well. Others are doing less well. It will probably, unfortunately, get worse before it gets better. Something I don't like saying about things, but that's the way it is. It's what we have. You look over the world, it's all over the world, and it tends to do that. The governors are working very, very hard, and we are supporting them 100%. Everything they need, they get, and we are taking good care. We have tremendous supplies and a great supply chain, whether it's ventilators or gowns or just about anything they need. So that's a big difference from inheriting very, very empty cupboards. The median age of those who succumb to the China virus is 78 years old.
It is not a China virus, and the claim that President Trump inherited empty cupboards has been repeatedly debunked.
Conditions, whether it's heart or diabetes, but usually it's some kind of a condition. It seems that people have that, and if they do, it's a problem, no question about it. Young adults may often have mild or even no symptoms. They won't even know they're sick. They won't have any idea that they have a virus. They won't have any idea at all. America's youth will act responsibly, and we're asking everybody that when you are not able to socially distance, wear a mask, get a mask. Whether you like the mask or not, they have an impact, they'll have an effect, and we need everything we can get. Data shows children have the lowest fatality risk. 99.96% of all virus fatalities are in adults. Think of that. So that's much, much, much less than 1% for children, young people.
Okay, well, this is very important to put these numbers in context when President Trump suggests that children are exempt from this virus. First of all, they are not. Over 175,000 children have become sick with this virus. Over 220 have died. And when President Trump says that the fatality rate for children in the U.S. would be less than 1%, it's important to note that there are 56.6 million K through 12 aged children in the U.S. So if you're talking about anywhere near 1% of them being killed by this, that's getting close to that's talking about 500,000 kids, and that is not a small number. And even if you're looking at 0.1%, that is still 56,000. And even if you're looking, anyway, it is not a small number, is my point.
And at the beginning, people never had an experience like this, where we needed so many ventilators so fast, and even the use of the ventilators. But the doctors have become incredibly, and nurses and helpers have become incredibly good at the use of a ventilator, which is actually a very complicated procedure, and allocating remdesivir to hospitals based on new admissions, since it works best early in hospitalization. And that's something that they've really started. They're using it much earlier. Fatalities nationwide have fallen 75% since mid-April. That's a great number. As cases and fatalities rise in certain hard-hit states, which you're looking at right now, we're surging personnel, supplies, and therapeutics.
Now, Dr. Fauci has warned to not be lulled into a false sense of complacency by the fact that the death rate had slowed. The death rate appears to be picking up again, and it is important to note that the number of Americans killed by this virus has nearly tripled since the last of the official coronavirus task force briefings that the president held just 3 months ago.
Suffering from this virus for a long time. We've done much better than most, and with the fatality rate at a lower rate than most, it's something that we can talk about, but we're working again with that.
It is simply not true to say that the U.S. has done better than most countries by virtually any objective metric. The U.S. has done either the worst or near the worst. The president has falsely, repeatedly claimed that the U.S. has the lowest mortality rate. As Fox News' Chris Wallace pointed out in the interview that aired this weekend, the U.S. is 7th in the world. 7th away from being the worst mortality rate in the world. It has the highest number of raw deaths, with over 141,000 Americans having been killed by this disease.
Today, the average age is significantly younger. Hospital lengths of stay are almost half of what they were in April. So the stays are about half. The rate of cases requiring hospitalization has been reduced, and mortality among those admitted to the hospital is nearly 1/2 of what it was in April. We've learned a lot. We've learned a lot about this disease, how to handle it. The doctors have learned a lot, not only in the use of the ventilators, but in many other things. And things are happening, too, like the remdesivir and other elements, steroids, etc. But these trends could change without our continued and relentless focus. And that's what we have. We have a relentless focus, and it's been that way from the beginning. But we've learned so much. As you know, in recent weeks, we've seen a concerning rise in the cases in many parts of our South. You look at...
The president says that he has a relentless focus on this crisis. I would like to highlight that his Twitter feed suggests that his focus is very much elsewhere. Today he has been making false claims about mail-in voting. He has been bragging about the stock market. He has been complaining about the prosecution of confessed criminal Michael Flynn. He has been complaining about the fake news. He has been complaining about athletes kneeling during the national anthem. He has been bragging about good reviews for his interview with Chris Wallace. He has been complaining about the Obama administration. His focus seems very strongly not to be on this crisis.
Conducting 50% more tests than Europe. And we've conducted nearly 3 times as many tests as all of the other countries in the Western Hemisphere combined.
That is a false statement. He just said that we have done more tests than all of the other countries in the Western Hemisphere combined. It is simply not true. We have finally, belatedly, at this point, done more tests total than any other nation, but we are nowhere near the number of tests of all other Western nations combined. We are not even near the total number of the next 5 countries combined. Furthermore, in testing per capita, we are still not ranking very high.
Provide recommendations to the various leaders of the state, including hospital administrators, etc. My administration currently has 0 unfulfilled requests for equipment or anything else that they need from the governors. No governor needs anything right now, and we think we'll have it that way till the end because, frankly, we are stocked up and ready to go.
Well, I can tell you that right now in Florida, at least 49 hospitals are out of ICU beds. They have exceeded their capacity.
The military has been fantastic. We're closely monitoring hospital capacity in these states. Hospitals are open for elective surgeries and other procedures. So hospitals are open for elective surgeries. We want Americans to get the medical treatments they need. All of the governors we've spoken with say they have enough bed capacity. That's a great thing. Our initial shutdown was to prevent the overflow of our hospitals and to...
I need to get the most current numbers on bed capacity, but Florida is rapidly running out of ICU beds.
Now, this would be completely unsustainable, produce debilitating economic fallback, and lead to catastrophic public health consequences. There are consequences to shutdowns, and we've saved potentially millions of lives by doing the initial shutdown, but now we're very aware of this disease. We understand the disease to a large extent. Nobody's going to maybe ever fully understand it, but we'll end up with a cure, we'll end up with therapeutics, we'll end up with a vaccine very soon, all three. We're instead asking Americans to use masks, socially distance, and employ vigorous hygiene. Wash your hands every chance you get while sheltering high-risk populations. We are imploring young Americans to avoid packed bars and other crowded indoor gatherings. Be safe and be smart. We're surging testing capacity to identify and isolate cases. This includes a newly approved testing platform to nursing homes across the South. We're being very, very vigilant with respect to nursing homes because you know all of the problems that we've had with so many people, so sadly, they were infected, so that all of the staff and residents can be routinely tested and isolated to ensure our elderly are even more strongly protected than anybody else. That's really the high-risk people, the high-risk, wonderful people. Once this current surge in cases declines, this same testing platform will enable people to visit their loved ones after taking a test, which is a big difference. Ultimately, our goal is not merely to manage the pandemic, but to end it. We want to get rid of it as soon as we can. That is why getting a vaccine remains a top priority.
Now, it is worth noting, as President Trump talks about the importance of getting a vaccine, he fired Rick Bright, the doctor who was leading the U.S. efforts to develop a vaccine. Dr. Bright says that he was fired as political retaliation because he contradicted the president on the subject of hydroxychloroquine, and the president has announced that he will not work in partnership with the World Health Organization, so the U.S. Is going it alone on this effort.
Distributed in record time. That's what's going to happen. So our military is all set to go. We will deliver a vaccine, therapeutics, whatever it is necessary, and defeat the virus once and for all. And I'll take a few questions if you'd like. I will say this. I want to thank all of the staff, the White House staff, all of the doctors that we've been working with so closely, and just a lot of...
Now, it is very striking that there are no other members of the coronavirus task force team here. There are no medical professionals here, and Dr. Fauci has not spoken at an event that the President of the United States has been present at since he contradicted President Trump during the April 22nd coronavirus task force briefing.
A test every 2 days, 3 days, and I don't know of any time I've taken 2 tests in one day, but I could see that happening.
So Republicans and Democrats on Capitol Hill both said that they want to see more money for testing. They want to send billions of dollars to the states so they can do more testing. And you probably saw Mick Mulvaney the other day said that his kids, it took them a week to get test results back. He said this is simply inexcusable given where we are in the pandemic. Do you think we have a problem with testing in this country right now? And are you in favor of more money for testing?
We've done more testing by far than anybody. Some of the tests, because it is massive volume, it takes longer. Others of the tests, as you know, are very quick. They're 5-minute and 15-minute tests, and those are, frankly, the ones that I prefer. But we're doing...
The fact of the matter is that there is a substantial backlog for tests, even in areas where tests are available, and that is problematic for controlling the virus. Mayor Bottoms of Atlanta describes how an asymptomatic person in her household while waiting for the results of the test infected other people in the household. It is impossible to control a disease like this if our testing to identify who is at risk of spreading the disease can't give an answer within 2 weeks.
7 million, 6 million, and 4 million. I think that we are doing tremendous amount of testing, but if the doctors and the professionals feel that even though we're at a level that nobody ever dreamt possible, that they would like to do more, I'm okay with it.
Why are your doctors not with you?
So a couple of things here. So President Trump has contradicted his own press secretary earlier today. Kayleigh McEnany said that Trump takes multiple tests a day. He just said this is not true. I also want to share the first-hand experience of one of our producers based in a coronavirus hotspot. This producer has waited more than 10 days for the results of their coronavirus test, and therefore has had to be in doubt, in insecurity, and had to deal with the question, do I go out and interact with other people when I don't know the results of this test?
On how we've handled the VA. On the VA, we got Veterans Choice. Nobody thought that would be possible. That's
the Veterans Choice was that President Trump routinely takes credit for, was signed into law by Barack Obama in 2014. President Trump is also boasting about job numbers. He is saying that the large number of jobs added back in the last 2 months is impressive, but the problem is we're still in the hole. The job losses over the months leading up to that far exceed the number of new jobs. The unemployment rate is hovering over 10%, and while better than last month's, it is still worse than at any previous time in history since the Great Depression.
Lives, we did that, and now we've started them up, and I think we've really started it up very successfully. Yeah, please.
Mr. President, thank you, Mr. President. You've been saying for months that the virus would simply disappear, and now you're saying that it's likely to get worse before it gets better. If it does keep getting worse, if Americans keep dying, are you responsible for that?
Well, the virus will disappear. It will disappear. I think that I always like to say, as you know, either way, when you look at it, the governors are working with me. I'm working with the governor. We're working hand in hand. I think we're all responsible. I view it as a team. Very good relationships with the governors. Very, very good relationships. I could say I'm fully responsible, but, you know, one day we had a virus come in, and I closed the borders, did a lot of things that were very good. In fact, Dr. Fauci said we saved tens of thousands of lives when I closed the border, and nobody wanted to do it. I wanted to do it. We closed the border to China. We put on the ban.
Trump repeatedly makes these false claims about his travel restrictions on China. First of all, it is false when he says nobody wanted to do it. He's the only one who wanted to do it. He was supported by the full medical establishment within his administration in doing it. It was not criticized by his opponents as he has suggested. However, it was not a complete ban. It was not early. Some 39 countries had more tough restrictions earlier or around the same time, and because of the large number of exceptions it allowed and the fact that no real plan was put into place immediately following that, there is no evidence, according to Jennifer Nuzzo, an epidemiologist at Johns Hopkins, that it actually resulted in saved lives.
And sending your tests in, and, you know, it goes through the mail one day, comes back another day, no matter how they send them. It's a day and a day, so that's 2 days already wasted. And then if it spends by the time you get it back, it's 3 or 4 days if they do an efficient job. We're trying to get the testing on site.
Thank you.
I like it the best.
And my follow-up, my second question, it's a little bit a different topic, but it's one that a lot of people are talking about. Ghislaine Maxwell is in prison. And a lot of people want to know if she's going to turn in powerful people. And I know you've talked in the past about Prince Andrew, and you've criticized Bill Clinton's behavior. I'm wondering, do you feel that she's going to turn in powerful men? How do you see that working out?
I don't know. I haven't really been following it too much. I just wish her well, frankly. I've met her numerous times over the years, especially since I lived in Palm Beach, and I guess they lived in Palm Beach. But I wish her well, whatever it is. I don't know the situation with Prince Andrew. Just don't know. Not aware of it.
Mr. President,
Thank you, sir. On unemployment insurance, how much below $600 are you willing to go? And you said that the economy is bouncing back strong, so why do we need to even cut it at all?
Well, the economy is getting stronger, and I think we have a chance to have a very strong economy, especially if some of the things that I just spoke about work. We want to have people go back and want to go back to work, as opposed to be sort of forced into a position where they're making more money than they expected to make, and the employers are having a hard time getting them back to work. So that was a decision that was made. I was against that original decision, but they did that. It still worked out well because it gave people a lifeline, a real lifeline. Now we're doing it again. They're thinking about doing 70% of the amount. The amount would be the same, but doing it in a little bit smaller initial amounts so that people are going to want to go back to work, as opposed to making so much money that they really don't have to. But we were very generous with them. I think that it's been a tremendously successful program. The whole thing has been successful. If you
Republicans have been repeatedly making the argument that if people make too much money on unemployment, they will simply refuse to get jobs or go back to jobs. And what is getting lost here is that we have record high unemployment, or virtually record high unemployment, because businesses are closed. There are not jobs for most people to be had, and workers are scared for their safety in going back to jobs. It is a far greater obstacle that industries are closed and workers feel unsafe than that workers are just raking in too much big bucks on unemployment.
I view it this way. Anything that potentially can help, and that certainly can potentially help, is a good thing. I have no problem. I carry it. I wear it. You saw me wearing it a number of times, and I'll continue, please.
So now that it has apparently become clear to President Trump that this virus continues to be out of control and wearing masks would help, he is speaking about how he says that he often wears a mask. He has almost never been seen in public wearing a mask. He violated Michigan state law by refusing to wear a mask when he went to Michigan. He violated the law, the ordinance that was in place in Atlanta when he went to Atlanta without a mask. He has repeatedly refused to wear one and has emboldened so-called anti-maskers to not wear their masks. And he has publicly said in the past that people were only wearing them to make him look bad.
Some would look at it that way. The sudden embrace of masks, social distancing,
Well, I've always agreed with that. I mean, I've never fought either one, but certainly social distancing. I want to. That's common sense. 6 feet to me is common sense.
The president is claiming that he has never opposed social distancing. He has held rallies in recent weeks in which there has been no social distancing. This includes events at Mount Rushmore, in Phoenix, Arizona, as Arizona was becoming one of the nation's leading hotspots, and his rally in Tulsa, Oklahoma, which, despite sparse attendance, public health officials there say did, in fact, contribute to a spike in coronavirus cases following the rally.
But Texas is a big state, and it's very well run, and so is Florida, and I think they'll do a very good job.
changing your tone, though, sir?
I just wanted to ask you about the issue of vaccines, which you already mentioned.
And President Trump just said that Texas and Florida are very well run. It is important to note that Texas and Florida were two of the last states to do any business closures. They were two of the first states to open businesses, and there are current surges. They are two of the nation's largest hotspots. Florida is reporting that ICUs are at capacity at 49 hospitals. Texas is reporting record high hospitalizations. But President Trump continues to praise the Republican governors of those states, while he has repeatedly slammed the Democratic governors of states like New York and New Jersey, which, despite being early leaders in cases and deaths, have, through aggressive public health measures, gotten this virus under control.
They see a lot of positive things happening on this front, too. Thank you very much. Thank you. Thank you.
All right, and that appears to be the end of today's Coronavirus Task Force briefing, minus the Coronavirus Task Force. I do want to highlight something, because as your fact checker, it is very important to me personally and professionally that I give you the best possible facts. President Trump has repeatedly claimed that the U.S. has done more tests than all other countries combined. This is a wildly false claim. It is nowhere near the truth. Today he claimed that the U.S. has done 3 times more tests than everyone in the Western Hemisphere combined. While that is technically a false claim, it is close to being a true claim. The U.S. has done 49 million tests, and the other countries in the Western Hemisphere have done about 17 million tests. So while the total number of U.S. tests is not quite 3 times those countries, it is close to it. So the president was closer to being accurate in that statement than I thought, and I wanted to clarify that for you. Nevertheless, the president continues to mischaracterize the state of this virus in the country and the state of his response to it. We have put several videos in the comments that I hope can be helpful in elucidating areas where the president has been incorrect. One of them is a timeline that lays out the actual response that he had to this virus, so that when he says that he acted very early, very quickly, very aggressively, and saved millions of lives, you can evaluate for yourself whether that is true. He has continued to say that he has always taken this seriously. We have a video in the comments that lists the many, many, many times in January, February, and March when he suggested that there was nothing to fear from this virus and scoffed at ideas to take it seriously or to take aggressive action to stop it. My name is Alan Piper. I am the senior politics producer at NowThis. If you have further questions, I will attempt to answer them. If you tweet them at me at apiper13. I want to thank you for tuning in. I had support today from our full newsroom, all of us working remotely, most particularly from Ian McKenna, Shelby Vacalin, Maddie Green, Brandon Caruso, and Alex Rabinowitz. This is technically, I guess, supposedly the Coronavirus Task Force briefing. He had stopped branding his events as that in April, after a fairly disastrous news conference in which he suggested that it would be perhaps a good idea to inject people with disinfectant as a treatment of this virus. Shortly after that, he stopped having daily briefings. He tweeted that it was not worth his time, and he has repeatedly made public statements suggesting that the virus was so completely under control that it was no longer necessary to have such briefings. In the 3 months since he stopped having regular briefings, the number of U.S. deaths has nearly tripled. And today it stands at a staggering 141,000 deaths. At the date when I recorded the timeline video at the beginning of May, I could barely bring myself to say the words that it had taken 65,000 American lives. It is horrifying to be at a moment where 65,000 looks like a small amount. That is why all of us at NowThis urge you to follow the guidance of public health officials, to maintain social distancing, to wear a mask in public, and to follow all public health guidance. These are not actions taken to curtail your freedoms. These are actions taken to protect your life. Here in New York, where we were hit early with this virus, where the virus spread before we had any ability to know that it was coming, because the president had not shared with the nation the briefings that had been made available to him by his own intelligence agencies. Here in New York, we suffered over 30,000 deaths, and we prayed that all other states could learn and could prepare in advance so that no other state could go on to become a new coronavirus epicenter. Instead, Governor DeSantis of Florida mocked the state of New York and said that Florida was different from New York and that Florida would never be in the kind of condition that New York was in. And today, Florida seems to be rapidly becoming the world's largest coronavirus epicenter and is rapidly running out of hospital beds. I do not wish this wherever you live, whatever party you belong to. I do not wish this on any of you, which is why I urge all of you to take the precautions that public health officials advise. Thank you for tuning in. We will get through this together. My name is Alan Piper. Please take care of yourself, take care of your loved ones, and let your loved ones know that you love them, while you still have the opportunity to let them know that. Thank you, and good night.